Lawmakers are considering two bills related to transgender medical care.
Some are calling the bills an extreme political attack on transgender people, while others say this is the best public policy for Texas. ABC 7's Rachel Phillips takes us through these bills and looks at both sides of the argument.
This is also one of the most extreme political attacks on transgender people in memory.
One bill discourages doctors by prohibiting professional liability insurance from covering transition-related care, while the other proposes that any medical or mental health professional that performs transition-related health care would be considered to be performing child abuse.
Care to transgender children is medical care, and it is health care. And I'm offended when people think it's otherwise.
Sometimes kids think they want to do this, and then later on they change their mind. When you get into the gender modification and taking some of those strong steps, whether it's surgery or hormones or other things, then those have some life-altering consequences.
A growing concern among the LGBTQ community is that if these bills pass, suicide rates could increase. 40% of transgender people have attempted suicide in their lifetime, which is 9 times the rate among all people in the U.S.
Give me the tools to prevent that child from committing suicide. Give me the tools to help that child be raised in a way that they can become a productive member of society.
Some transgender people started transition affirming at a young age, and they believe that's the only reason they're still alive today.
I was so unhappy. I was so miserable living in that body that I knew wasn't mine. And it's so rewarding to be able to look at myself now and be like, oh, thank God.
Jocelyn Stout was 15 years old when she started receiving hormones and 20 when she had surgery.
The fact that I did get to start, as a teenager and younger really helped me to blossom into the woman I am now.
We're not trying to tell anybody that they're inferior, that they're not as worthy. What we're saying with House Bill 1399 is it's just too early in a person's life to be making these life-altering decisions.
Dr. Bert Johansson says he supports giving transgender youth a group of hormones that prevent the progression of puberty until they're at an age where they can make a more educated decision instead of implementing these bills.
I don't think we should be artificially blocking any kind of response from the body or the natural way the body is growing and maturing.
Think about how devastated trans youth are going to be. Them losing all hope, for a happier future.
Rachel Phillips, ABC 7.